Hey everybody, Dr. Doug Bonison here at Bodyworks Physical Therapy for our weekly virtual office. Thank you everybody for the views, the reposts, the questions, and the feedback. We've been getting a lot of good feedback from these virtual office snippets. So what we want to do with the virtual office is we want to educate people of what we do behind the scenes and how we do it and why we're doing it. So if you notice, the title of today's talk was, "Are you running on faith and fumes?" That was one of my patients. She was a gal, and it was talking about how she drives her car. She goes, "Oh, I drive on faith and fumes." I said, "Well, that's a good one. That just made the quote wall." And we actually see a lot of people that are driving and running their life on faith and fumes, and you know, the toll that takes, the stress, and people have injuries, and that just kind of compounds the injuries. And sometimes people don't get over their injuries very quickly, and they see multiple healthcare practitioners. A lot of those people end up in our office, and I've got 3 right now that have seen multiple healthcare professionals, and they drop in our office, and we get to the bottom of it, and they're all getting better. We're figuring it out. So, and what we've done with our treatment here, we kind of show you how we treat our patients, and we've come up with a little mnemonic. It's called Elite Treatment, okay? And we spell a little bit differently, but that's because we're kind of different. And the E just stands for elite, but the L-E-E-T-E, I'm going to go through each one of these. The first one's the L's, listen and understand. Every patient has a story, and we like to listen here. We want to know what's going on and why it's going on and all the different things that is involved in what's going on with your life. We feel like there's a lot of people in medicine that don't listen. You come in, you say 20 seconds of words, and they already in the treatment, and they already have an answer. We don't do that. We want to listen. We want to hear about what's going on and why it's going on, so we can better understand to get to the root of the problem. The next thing is evaluate. We have some evaluation techniques here that no one else is using around here, and that way we can get to the root of the problem better. I just got back from a conference this weekend from a gentleman who people flying from around the world for him to treat, and I'm learning some of his treatment and evaluation techniques, and it's phenomenal, and you get really nice results. Educate. That's one of the big things here. Is we call ourselves a co-learner clinic. We want our patients to understand what's going on, why it's going on, and what to do about it. We think that's key, because sometimes if you don't get your questions answered, you're just stuck. And no one tells anybody anything in medicine. They go, well, just have this test or take this drug. Well, why? Well, we want to tell you why, what we're finding, what are our evaluation techniques telling us, and how that relates to what you have going on. So we want to educate you about what's going on with your knee or your back or your spine, and then what to do about it. Treatment techniques. We've got different treatment techniques that, again, no one else is using. I've got some special training. Cody's got special training in a lot of different areas, and we just bring a unique treatment approach to all of our patients. And we want to treat the whole person, not just the knee or not just the hip or the shoulder. We want to treat everything that's influenced that area, because a lot of times the site of the pain is not the source of the problem. And you've got to learn different evaluation techniques to know what those other influences are that may be causing problems somewhere else. And we've figured a lot of that out. And the last one is empower. We want to teach our patients what to do so they can help themselves stay better, so they don't have to come see us as much. Because one of the things we don't like to do is we don't want to waste people's time or money. People's time is important, people's money is important. So we want to be able to empower them with exercises and things to do to avoid further injury in the future, and so they can be in better care for themselves. So if you've been running on faith and fumes and have any chronic injuries or things that are just bothering you can't get over, come see us here at Bodyworks Physical Therapy, where we help you get to the root of the problem and not just treat the symptoms.